Hi, my name's Kathleen Rodriguez. I'm a registered nurse, and I've been a nurse for 25 years. As I've worked in ICU and acute care settings, and also I'm full time at a long term facility in their ICU, and I also do charge nurse responsibilities. The facility I work in, we have acutely ill, multi organ failure patients, and I enjoy my job.
What's a typical day at the hospital for you?
Typical day, usually I'm in ICU, and state law requires that ICU nurse can only take care of two patients. Um, and the patients are usually on the ventilator and have had kidney failure.
Have you seen patients leave your unit?
Um, yes, they go out from the ICU. If they're in ICU, usually they're on one of the requirements for an ICU patient. They need to be on a medication continuously through their IV, that we have to continuously monitor their blood pressure because these medications affect their blood pressure. So once their blood pressure is stabilized, then they go out to the med surge or the tele floor or our direct observation unit, and sometimes they come back to the ICU. Their length of stay in our hospital is probably about a month, and we have problems with reoccurring infections. So when that infection goes septic, where it's in the blood system, then they can go into shock, and they need those medications to control their blood pressure, so they come back to the ICU.
Oh, um, sanctity of life versus quality of life. Do you feel like doctors have the right to keep their patients alive no matter what, even though their quality of life may be diminished through living off a ventilator?
I think doctors have the right, but the patient has the overall um, their decision. It's the patient's decision whether they want treatment or not. If they're unable to make that decision, which a lot of times they are, then usually it's a family member that are asked what end of life treatments they want or what procedures they want done. Ultimately, it's the patient.
Do you have any shocking stories from the ICU that you'd like to share?
Um, I've I've seen a lot of sick patients, um, and when your body is failing, the organs are failing, it changes their physical appearance drastically. They usually get swelling, and their limbs, their hands, their feet will become cyanotic because the medications we use are so potent. They they're designed to get that blood into the organs that are the heart, the liver, the heart, the lungs, the brain. So it takes that circulation from your hands and your feet. So the hands and feet sometimes will get mottled or cyanotic, cold. Um, and some do well.
Do you ever get to know these patients, or do you feel better distancing yourself from them personally?
when you're in a situation, whether you're gonna survive or not, I think the mind and the determination that you have, whether or not to survive, is based on goals, and whether it's a spiritual goal or something out there that's keeping you to continue to fight, whether it's your children or your loved ones, whatever that may be. I like to find out about my patients and see what their goals are, see where their heart is, and remind them of their goals and their so they can continue to survive.
Do other nurses like to get connected like you?
There's a lot of caring nurses, and death is never easy for the loved ones or for the family.
When a patient dies, what do you do?
My role when a patient passes away, by law, we have to call one legacy within an hour of their being pronounced. One legacy is a 800 number that records all the deaths. And then we discuss with the family what their mortuary plans are.
Do you hold the body in, do you hold the body?
Our facility doesn't have a morgue. A morgue is usually where they have refrigerated sections that the body would go to. We don't have that. We don't have the refrigeration that a morgue usually has. So we're able to hold the body for 24 hours until the mortuary comes to pick them up, or for the family to make some final decisions.
Have you ever had to tell a family member that their loved one has passed away?
Multiple times.
Does it end well? Does it go well?
Even though they've been sick a while, I don't think anybody ever expects it. But there's a lot of grieving, and it's not easy to inform them.
Have you ever had to tell them face to face, or is it usually over the phone?
Both, 50-50. We try not to, if we see somebody that's not doing well, that's near end of life, and we've notified them that they're not doing well and we know they're on their way in, sometimes we'll wait until they actually arrive to inform them of the passing.
That's it.